This is Scott Becker with the Becker Business and the Becker Private Equity podcast. We're visiting today with Amber Walsh. She's a brilliant lawyer at the intersection of healthcare and private equity. She's going to talk to us today about several things to know about a specific transaction. Amber, let me ask you to tee it up and tell us about the SinglePoint Helix transaction and what makes it so interesting, and then talk us through what people should know about this and why it's impactful.
Yeah, thank you, Scott. Happy to be here. So a week ago today, SinglePoint, which is backed by DFW Partners, announced that it had acquired Helix Infusion Services. Helix was formerly owned by TA Associates. And what's interesting about the deal is that it really exemplifies a lot of the trends that we've been following for the past couple of years, particularly coming out of the pandemic. And our firm didn't work on the deal. I'm familiar with all the players, but we didn't work on the deal. So I'm not commenting on the players at all. But I am really interested in several facets of the deal that make it kind of this perfect little example of what private equity investors are looking to do and grow, and how they're looking to differentiate themselves, not just within the infusion therapy space, which is what this Helix deal was, but kind of across the board.
Well, thank you. And talk to us about, maybe give us a little context in the deal, but also talk to us about what are some of those lessons that are broader for private equity.
Yeah, so SinglePoint was already in the infusion pharmacy or infusion therapy space. They had done a couple of add-on acquisitions. Helix, also private equity based, had also grown through a series of acquisitions and de novo builds. Helix, at the time of the deal, and it's only been a week, so presumably not much has changed, had managed or owned 220 infusion therapy or infusion pharmacy sites across 38 states. So it's kind of that perfect example of the scaled platform. And those sites, and this is another feature of it that makes it so on point for what so many investors are looking at right now, those sites were dominantly, if not exclusively, physician-owned and physician office-based, where Helix provided management services, or home-based, or at least kind of walk-in outpatient-based. They were not hospital-based. And that's been one of the big drivers. Obviously, the pandemic, we all know that the pandemic was a huge boost for a lot of things that were previously thought of as a hospital-based service, moving into an outpatient basis. And the Helix platform and what they've grown over the past several years is kind of a perfect example of that.
Fascinating. And so where does this take Helix going forward? What does this look like going forward?
Yeah, so according to their announcement, and this is pretty common, the announcement for the SinglePoint side, the buy side, is that it gives them this platform, including with the physician management component of it that I don't think they previously had. It gives them not just the scale across a lot more states, but it also gives them this model where manage physician-owned centers for a portion of what they do. The other thing that they talked about in the press release, which is not at all surprising, we've seen this kind of across the board in infusion pharmacy for the past several years, which is the reimbursement impact with payers. So payers, you'll see some quotes that as payers are able to move their members from the hospital setting for infusion to an outpatient or home setting, that they can save anywhere between 20 and 40%. Of course, those are big numbers, those are global, and I don't know if that's what Helix was achieving for payers, but certainly what SinglePoint and Helix talk about as one of the benefits of Helix is certainly consistent with what the industry has been looking at. And of course, we see that outside of infusion therapy too, which is just that migration, but also the ability to have a payer and reimbursement play and make yourself attractive as a platform to where you're not just attractive because you're adding on more and more sites. You are attractive because you're able to lower the overall cost of care and be part of the win-win solution.
Fascinating, fascinating. And is this acquisition? I don't know how big an acquisition of it is. Is this an indication that there's just more private equity money flowing towards healthcare and deals getting done again, or can you not generalize towards that point?
Yeah, the deal terms are undisclosed. Just generally in infusion therapy, when the deals get reported, they're often in double-digit multiples. But our perception is the feeling that we've had as a firm for certainly most of 2026 is that yes, there are more deals getting done. It's not high volume. It's not frenetic. It's not like it was in 2021 and 2022, but deals are getting done. The reins are getting loosened, and some of the deals are very large. But the other feature of those, some of the deals that we're seeing, which I think is also probably consistent with Helix. If I were a lawyer in that deal, it would have certainly have been for us, which is there's a big regulatory component to the infusion therapy space. So obviously, any healthcare industry, any private equity investor in healthcare has to understand the regulatory environment across the board, but in that subsector. And infusion therapy particularly has some real hot button issues because these are stark services. So they're heavily regulated, and there are a lot of physician relationships and referral sources in there. So I am guessing that the lawyers that worked on that deal diligenced it pretty hard, including from the lender side, et cetera.
Fascinating to hear. And you're right. There was a frenetic, crazy pace 2021, 22. Now busy, but not insane, but busy. And people looking at lots of different places to put money in healthcare private equity. And fascinating to see it move into technology infusion services, still in surgery centers, lots in pharma, lots in other areas, and still some in the practice area too. I mean, that hasn't stopped. It's changed some, but it hasn't stopped.
That's right. And you mentioned the practice area. That's the other interesting feature about infusion therapy is that the Helix deal involved freestanding centers, and then they have this model of managing physician-owned centers. Well, you see infusion as an ancillary service in a lot of PPM businesses. And so this is one of the places where you see a point of connection between physician practice management businesses, especially those that are high infusion, like oncology or GI or rheumatology or immunology, and then connected to the separate private equity-backed infusion platform. So you see this come up in a lot of areas, very similar to the ambulatory surgery center sector, which is it can be a freestanding business just of ASCs, or an ASC can be a really important part of a PPM's strategy.
Right. You also saw things like Cardinal Health buy a big oncology platform too, that had a combination of physicians and infusion too, right?
Yes, absolutely.
So you do see a lot of these different evolutions of things where there's physicians and infusion and ancillaries, infusion being the ancillary, but lots of opportunities. Fascinating, fascinating, fascinating. Amber, anything else you want to share about this deal and so this evolution? But your point is so well taken. This isn't just ambulatory infusion; it's ambulatory infusion and physician practice management, even if staged in a slightly different way.
Yeah, that's right. And I just think I really enjoy seeing these announcements come out, seeing what I think of as kind of a classic deal. A classic deal where you have private equity on both sides. You have seen scale happen by both the buyer and the seller prior to the deal happening. It has a lot of features that private equity investors are looking at when they're growing a platform, selling a platform, hoping that it's going to be able to achieve what what it needs to achieve. And then there's pieces of it, of course, that I don't know since I wasn't part of the deal, but I've got to think there was heavy diligence, not just on those referral relationships, but on supply chain and drug costs and, all of these things. It just really comes back to this is kind of a quintessential, from what I can tell as an outsider, kind of a quintessential private equity backed deal in a space that's really popular right now, and therefore I think is worth talking about.
Couldn't agree more. Amber, I want to thank you as always for joining us on the Becker Business, the Becker Private Equity Podcast. You are as good a leader as they come, the very best. Thank you for being with us today.
Thank you, Scott.